So now a very important topic we're gonna start is trigeminal neuralgia. Bismillahirrahmanirrahim. Trigeminal neuralgia is very important from the dentistry point of view. A lot of patient comes of this is a complaint after post extraction that we have a unilateral facial pain. Okay, let's start it. So basically, there is a sudden means it is a sudden acute, usually unilateral and severe brief stabbing pain, stabbing and recurrent pains, stabbing and recurrent in the distribution of one or more bundles of the fifth cranial nerve, means trigeminal nerve. So basically it is a sudden and stabbing recurrent pain. Pain feels like a sharp stabbing electric shock, like you feel like you have an electric shock. There are trigger zones, means there's a very special type of trigger zone that in which the pain is feel actually. Then the key features is basically paroxysms of sharp and stabbing pain, trigger zone, provoking factors when the patient eats something, when he's or she's talking, shaving or washing its face. Basically, it is the pain is usually confined to one division of trigeminal. Okay, it is unilateral, pain free during means the like you have in pulpitis the pain irreversible pulpitis. There is a basically pain actually at the night time basically, but here there is no pain during sleep. Okay, drug like carbamazepine is the medical treatment of choice. If someone asks you what is the treatment of choice for the trigeminal neuralgia, you give the patient carbamazepine. And peripheral or central surgical treatments and management options are present. You basically may have extended remission with the completely pain-free periods. Basically, sometimes it will pain-free, sometimes again it will happen. Okay, now medical management of trigeminal neuralgia, you give anticoagulants, which is carbamazepine, currently the drug of choice. The initial dose is 100 milligram twice daily, and it is increased gradually by 100 milligram each day until the pain is controlled. Means the patient is prescribed carbamazepine 100 milligram twice a day. Basically, this amount is increased until the pain is in control. The maximum dose is 800 to 1000 milligram should be and it shouldn't be exceeded from that. Monitoring for patients on carbamazepine is very important. Full blood count, you have to check the for any thrombocytopenia, leukemia, etc. Liver function test that you are giving a drug, so how the liver gonna metabolize, so you should know it. Then electrolyte balance you should know. Parallel to the therapy should be before the therapy, and then at 1 month you should also monitor, then at third month you should also monitor it. Okay, so we have discussed some important, like trigeminal neuralgia is very important. So you have a very stabbing, sharp, sudden onset pain. You have actually recurrent a pain-free sleeps actually. Then you have trigger zones basically. Okay, and drug of choice is carbamazepine. Basically, you have a